Providing tracheostomy care will require the assistance of another staff member. Use sterile or clean technique according to facility policy. For the long-term trach patient in this video, clean technique is used.
Begin by explaining to the patient what you are about to do.
But my assistant here is going to give you some breath with the bag. I'm going to suction you and change the dressing in the trach tie. I'm going to suction you one more time here. Just in. Remove your gauze here.
Before taking off your gloves, remove the soiled tracheostomy dressing and discard it and the used tubing appropriately. While the patient replenishes her oxygen stores, prepare the equipment on an overbed table with the help of your assistant. First, open the sterile tracheostomy kit. Using aseptic technique, don one clean glove and prepare the other supplies with the help of your assistant.
Now don the other glove and place the drape from the kit on the patient's chest to protect her from spills.
Remove all other supplies from the basin, except for 2 of the 4x4 gauze pads and the cotton-tipped swabs.
And my split gauze.
Pour an equal amount of normal saline and hydrogen peroxide into the basin.
I have 3 Q-tips.
Clean the skin around the trach site with cotton-tipped swabs and gauze pads soaked in the hydrogen peroxide and saline solution.
Using your dominant hand for sterile supplies, clean the stoma area.
It's going to be cold.
Move in circles from the center outward, cleaning for 2 to 4 inches around the stoma.
Okay. I'm going to take a gauze.
Then use normal saline-soaked swabs and gauze pads to rinse the tracheostomy tube and skin.
Just rinse this off. Make sure we get all the peroxide off of your skin. It's going to be cold. Okay.
Finally, use dry gauze pads to gently pat the skin and exposed surfaces of the outer cannula. If her tracheostomy has a non-disposable inner cannula, use your non-dominant hand to remove the inner cannula while touching only the outside of it. Then drop it into the hydrogen peroxide basin. Pick up the inner cannula with your dominant hand and use the small brush to remove secretions on the inside and outside of it. Hold the cannula over the hydrogen peroxide basin and rinse it with normal saline, using your non-dominant hand for pouring.
Then replace the inner cannula, secure the locking mechanism, and reapply the oxygen source as appropriate for your patient.
To provide care for a tracheostomy with a disposable inner cannula, remove the new cannula from its packaging.
Now withdraw the inner cannula by touching only the outside of it. Inspect the inner cannula for secretions. Then quickly replace the inner cannula with a new one and lock it into position.
Dispose of the contaminated cannula properly and apply the ventilator or oxygen source.
There, we're going to change
now
the
secure the
ties. This might
tracheostomy.
make you cough a little bit, so
For the trach tie method, have an assistant put on clean gloves. While she holds the tracheostomy tube securely in place, remove the old ties.
How's your breathing? Good.
Then insert one end of the prepared twill tape tie through the faceplate eyelet and pull the ends even. Wrap both ends of the tie behind the patient's neck and insert one end through the second eyelet. Pull both ends snugly. Then tie the ends in a double square knot on the side of the patient's neck. Then insert a fresh tracheostomy dressing under the clean ties and faceplate. Insert a fingertip between the ties and the patient's neck.
You want to check to make sure you
The
put
tie
two
should allow
fingers.
space for only one loose or two snug
Okay.
finger widths.
We need to listen.
For the trach tube holder method, have an assistant hold the tracheostomy tube securely. If an assistant isn't available, leave the old trach tube holder in place until the new device is secure. Now align the strap under the patient's neck, making sure the Velcro attachments are positioned on either side of the tracheostomy tube.
I'm going to slip this under here.
Then place the narrow end of each tie under and through the faceplate eyelets. Pull the ends even and secure the Velcro closures.
So it's not too long.
Verify that there is only enough space for one loose or two snug finger widths under the
How's that
neck
feel?
strap.
Good? Okay.
When tracheostomy care is completed, position the patient comfortably.
Comfortable?
As part of your follow-up
bad.
care, assess the patient's respiratory status and compare her findings before and after tracheostomy care.
Yep. And you're good to go.